Hello all, hope you're having a great day today. So today we are talking about is chapter 16, the guidelines for designing flexibility programs. The purpose of this chapter is to prevent flexibility as an essential ingredient of health-related fitness and to provide personal trainers or fitness professionals with a basic understanding of how to properly incorporate flexibility training into the exercise programs of healthy individuals. Flexibility refers to the degree to which a joint moves throughout a normal pain-free range of motion, or ROM. As most physical activities in sport consist of numerous multi-joint movements, it is essential that musculoskeletal function not be compromised by inadequate flexibility. Stretching is the most commonly used to increase joint range of motion. American College of Sports Medicine, or ACSM's current positions stand on exercises to develop and maintain fitness and flexibility in adults, recommends the inclusion of general stretching exercises and emphasizing the major skeletal muscle groups at least 2 to 3 days per week. Like body composition, cardiorespiratory fitness, or muscular strength, flexibility is classified as a health-related dimension of fitness. This means that flexibility contributes to an overall improved quality of life and fitness in athletes and the general public alike. Hamill, Knudsen, and Derrick suggest that several factors determine flexibility. These factors include joint structure, health of soft tissue around the joint, length of antagonist muscles, and temperature of the tissues being stretched, in addition to the viscoelastic or rubber band-like properties of the tissues surrounding the joint. Not surprisingly, then, flexibility is largely determined by how well these factors facilitate movement. Figure 16.1 depicts a typical human knee joint. To better understand the importance of the properties of the tissue surrounding the joint, study the anterior view, or panel A, and the cross-sectional view of panel C. Notice that the knee is padded with fat and is secured into place by ligaments. These tissues influence knee range of motion both at the joint itself and elsewhere in the lower extremity. For example, tightness of the ligaments or excessive fat surrounding the thigh could inhibit knee range of motion during flexion. In fact, one belief about bodybuilders is that they are muscle-bound and possess a more limited range of motion as a result of the additional bulk. This is true to a certain extent because thick skeletal muscles can certainly limit range of motion. Thus, if the training demands of an athlete or the natural healthy body composition of a client predispose them toward greater muscle bulk rather than flexibility, there may be a trade-off such that a more limited range of motion may be more appropriate. With increasing age, the ability to move through a full range of motion becomes compromised with an overall loss of flexibility of approximately 25 to 30% by age 70 years. The decreases in flexibility that one may experience will depend on the joint itself. Brown and Miller determined a 30% loss in hamstring flexibility from the age of 20 to 29 years to 70 plus years, whereas Germain and Blair found a 15% loss in shoulder flexion from the age of 20 to 30 years to 70 plus years. Loss of range of motion within a joint may have several causes. With age, changes occur in the framework of the connective tissue collagen fibers, as demonstrated by increased rigidity of the tissue. The increased rigidity is attributed to tighter cross-linkage within and between collagen fibers, which makes the joint more resistant to bending. There is also a reduction of elastin as well as a deterioration of the cartilage, ligaments, tendons, synovial fluid, and muscles with age, which may decrease joint range of motion. Physiological changes are not only suspect in the age-related loss of flexibility. Decreased physical activity appears to accelerate the age-related loss of range of motion. Numerous studies suggest that females are more flexible than males owing to a different pattern of skeletal architecture and connective tissue morphology and certain hormonal differences. The differences in range of motion between sexes may result from differences in joint and bone structure. For example, females typically have broader and shallower hips than males, which creates the possibility of a greater range of motion in the pelvic region. Gilbert also suggested that females generally have a greater range of extension in the elbow because of a shorter upper curve of the olecranon process of the elbow than males. Females may also have greater potential for flexibility and trunk flexion after puberty because of a comparatively lower center of gravity and shorter leg length. An individual's history of physical activity has an impact on his or her joint range of motion. Studies have shown that an individual who is physically active is also more likely to have a greater range of motion than a sedentary individual. Cornu et al. Demonstrated that volleyball players exhibited greater flexibility and wrist extension than sedentary individuals. In another sport-related study, Jaeger et al. Found the elite field hockey players had significantly greater hip range of motion than sedentary individuals. Studies have not been limited to sport activity, though. In a study by Vurips et al. That examined different habitual physical activity of older women, it was found that the more active older women had significantly greater flexibility in the hip and spine than moderately active and sedentary older women. As with other forms of physical training, flexibility training has both benefits and risks. These benefits and risks are frequently described from the anecdotal and personal experiences of coaches, clinicians, and exercise leaders rather than from sound research or understanding of the science of human anatomy, physiology, and biomechanics. Unfortunately, the existing science of flexibility training often presents fitness professionals with more questions than answers regarding the benefits and risks of stretching. The following two sections will provide the personal trainer with a short review of the scientific evidence supporting the benefits and risks associated with flexibility training. Flexibility training has been shown to improve an individual's joint range of motion. In a long-term study on the effects of flexibility exercise on shoulder and hip range of motion by Missner et al., it was found that the flexibility program used produced significant increases in shoulder extension by 5.7%, shoulder transverse extension 10.4%, hip flexion 13.3%, and hip rotation 6.3%. A minor improvement of 5.5% was also observed in shoulder flexion. Improvements in flexibility can be seen in a relatively short time period. Kerrigan et al. Recorded improved ROM values in both static and dynamic hip extension when participants followed the program twice daily for 10 weeks. Kukkonen and Malkia also found improvements in spinal range of motion and greater hamstring flexibility after subjects followed a 3-month program. The extent to which individuals can live independently in the community depends on their ability to perform basic daily tasks such as self-care and essential household chores. These tasks are informally termed activities of daily living, or ADLs. Balancing ability and postural control are critical aspects of performing ADLs. In fact, the ability to perform ADLs has been highly correlated with joint mobility. In other words, ADLs are easier to perform when an individual possesses an acceptable range of motion within the joint. In addition, flexibility exercises can significantly aid balance and postural stability, particularly when combined with resistance exercise. Thus, flexibility training can improve ADL functioning both directly through enhancing range of motion and indirectly through its effect on postural control. Hypermobility syndrome is known as congenital laxity of ligaments and joints. This condition is characterized by extreme range of motion accompanied by mild to moderate intensity pain. Although it is suggested that certain individuals or athletes, especially gymnasts, may possess extraordinary joint range of motion, there is insufficient scientific evidence to link hypermobility to flexibility training. There is some evidence to suggest that static stretching may contribute to decreased muscle strength. In a recent study, Nelson et al. Found that muscle strength and endurance performance reduced after short-term static stretching in physical education college students. Foles et al. Found similar results after prolonged stretching of the ankle plantar flexors. This voluntary strength deficit persisted for up to an hour after stretching. In addition, Kukkonen et al. Demonstrated that stretching prior to the execution of one repetition maximum decreased the performance of the lift. A review by McHugh and Cosgrave indicates that acute pre-participation stretching will decrease the ability to generate a maximal force, but if these stretches are part of other activities used in warm-up, then performance is not seriously affected. In fact, in activities such as gymnastics that require large range of motion movements, it is necessary to perform pre-participation activity to achieve the required range of motion for the performance. Thus, although these studies suggest that maximal strength or performance may be compromised following an acute stretching bout, it is possible that if pre-performance stretching is accompanied by other warm-up movements, pre-performance is not negatively impacted. However, because flexibility exercise may acutely reduce power and strength, it is recommended that flexibility exercises be performed after exercise in sports where strength and power are important for performance. Flexibility training is often promoted as a means of reducing injury risk. However, the research does not show a consistent link between performing regular flexibility training and a reduction in musculotendinous injuries. Reviews published regarding injury prevention and flexibility have generally been unable to conclude whether or not stretching before or after exercise contributed to injury prevention among competitive or recreational athletes. McHugh and Cosgrave suggested that there is some evidence that pre-participation stretching may reduce the incidence of muscle strains, but that it does not prevent overuse injuries. Finally, Whitverell et al. Concluded that the type of sport activity in which an individual participates is critical when determining the value of flexibility training to reduce injury. They found that the more explosive the skills involved in an activity, the more likely stretching may be needed to decrease injury. Interestingly, the duration of time that increased flexibility lasts after stretching may not be as long as what fitness professionals may think. Increased flexibility following acute stretching is extremely short-lived. DePino et al. Recruited 30 male subjects and found that the improvements in knee range of motion following static stretching of the hamstrings lasted less than 3 minutes. These authors further suggest that athletes who statically stretch and then wait longer than 3 minutes before activity can expect to lose any range of motion gained as a result of the preceding bout of stretching. Spernaga et al. Tested 30 male subjects and using proprioceptive neuromuscular facilitation on the hamstring muscles and found that range of motion improvements lasted only 6 minutes after the stretching protocol ended. Although this does not seem like a significant improvement, it was also found that hip flexion, passive range of motion, was significantly increased after 12 weeks of stretching. In fact, it was concluded that ACSM flexibility training recommendations are effective for improving hip flexion range of motion. Although it seems as though stretching has little acute impact, it may be that longer duration training is effective for increasing range of motion. And we will stop there for today.